Hello class, welcome back. So this next one is certainly not a fan favorite or a crowd pleaser. It's the whole pathway of cyclooxygenase 1 and 2, COX-1 and COX-2, in terms of all the problems that can happen and side effects if people are taking an NSAID or for example, taking prednisone or a corticosteroid, in terms of that inflammatory cascade and what happens in what regions of the body when these systems get turned on. So let's dive in.
So when there's an injury, illness, some other inciting event, or just a little bit of overuse, if you're exercising too hard, for example, membrane phospholipids are going to get activated via an enzyme called phospholipase A2. And that is going to produce arachidonic acid. Now, arachidonic acid, depending on where in the body this process takes place, has different effects. So in the GI system, COX-1 gets activated, and what happens with COX-1, right? We produce prostaglandin E2, and that increases mucus and increases bicarbonate in the stomach to help protect the stomach from its own acid. And if we knock that out by taking too much NSAIDs, we risk bleeding. All right, next, what happens in the kidneys? So here we have COX-1 and 2, right? That's the problem with the kidneys. It does both. And we get both prostaglandin E2 and prostaglandin I2. Some people call that prostacyclin. And that results in an increase in afferent, right, vasodilation, which is what we need, since that's going to improve our GFR and improve sodium and water excretion, right? And if we knock that out, and that's the problem in terms of kidney side effects. It doesn't matter what you take, a COX-1 or a COX-2, you're going to have sodium retention, H2O retention, and therefore hypertension. So over here, since it's mainly COX-1, if you just take a COX-2 inhibitor in general, you're going to protect your stomach, so to speak, and that's why a lot of people take celecoxib or Celebrex to prevent GI issues. All right, next, cardiovascular system. All right, so we have arachidonic acid going to all these systems. Now, cardiovascular also has a balancing act here. It has COX-2 and COX-1. Now, COX-2, we have prostacyclin. COX-1, we have thromboxane. Right? Now, prostacyclin results in platelet inhibition. Sorry, it's kind of sloppy there. A lot of people say platelet gathering inhibitor, whereas thromboxane, as the name suggests, thrombosis, right? That results in platelet aggregation. If we upset that balance, then we risk problems in the cardiovascular system. So, therefore, if we inhibit COX-2 only, right, then we're unfortunately going to increase cardiovascular events, right? Since all we have left, if we knock out all the platelet inhibition, all we have left here is platelet aggregation. And that's why the COX-2s have a cardiovascular event risk. One that was actually pulled from the market was Vioxx. That was actually COX-2 specific. We still have Celebrex, which is celecoxib. That's COX-2 selective, in that it mostly inhibits COX-2, but also inhibits to a certain degree COX-1, so at least there's a little bit less of a risk compared to Vioxx, but still a cardiovascular event risk. Now, in this injury model, the arachidonic acid also is having an effect in inflammatory cells, right, in the area of inflammation. So what's going on over here, right? That's going to be COX-2, and that's going to produce prostaglandin E2, which is going to result in things like pain, cell proliferation, and all those things that hurt when we get inflammation in the body. And that's why we take a NSAID to inhibit COX-2 or a COX-2 selective NSAID. It tends to reduce pain, and that's why it feels good. Which plays a major role in inflammation and stimulating the COX-2 pathway. So there you go.